You've got this tiny butterfly-shaped gland right in your neck, and believe it or not, it's the master controller for your body's entire energy system. Today, we're going to demystify the thyroid and talk about what happens when that all-important control system goes a little haywire. Okay, so the absolute best way to picture the thyroid. Think of it as your body's master thermostat. Seriously, it's always humming along in the background, making these tiny little tweaks to your metabolism to keep everything, running just right. But what happens when that thermostat breaks? All right, first up, let's explore what happens when that thermostat gets stuck on low. This is a condition called hypothyroidism, and it basically throws your whole body into a kind of low power mode.
So, hypothyroidism, what's really going on? Well, those crucial hormones we're talking about are mainly T4 and T3. They're the signals your thyroid sends out to manage your metabolism. And when you don't have enough of them, it's like your body's furnace just isn't getting enough fuel. The result? Everything starts to slow way down. You might feel totally wiped out, start gaining weight, or feel cold all the time.
So, you might be asking, what causes this to happen? Well, a lot of the time, the problem is actually coming from inside your own body. The number one cause is an autoimmune condition called Hashimoto's. This is where your immune system gets confused and starts attacking your own thyroid gland. But that's not all. Other triggers can be the huge hormonal shifts after pregnancy, or even something as simple as not getting enough iodine in your diet.
Okay, so if the big problem is just not having enough of a hormone, how do we fix it? Well, the good news is the solution is actually pretty straightforward.
Yeah, the treatment for an underactive thyroid just makes sense. We just replace the hormone that's missing. It's done with a medication called thyroxine, which you might also hear called T4. It's basically a synthetic version of the exact hormone your body should be making. This lets your doctor manually turn that thermostat right back up to where it needs to be.
But here's the thing. Taking this medication correctly is absolutely crucial. And as you can see here, timing is literally everything. For your body to absorb thyroxine the right way, you have to take it on an empty stomach. Things like your morning coffee, breakfast, or even other supplements like iron or calcium can totally mess with how well it works. So sticking to this routine is non-negotiable.
So how do doctors even know if the dose is right? Well, they measure something called TSH, or thyroid-stimulating hormone. Now think of TSH as a message from your brain. If your thyroid is sluggish, your brain starts shouting, right? So a high TSH means the brain is yelling at the thyroid to get to work. On the flip side, if the TSH is too low, it could mean your medication dose is too high. And that's exactly why this becomes a long-term partnership with your doctor, using regular blood tests to make sure that thermostat is dialed in just perfectly.
Okay, we've talked about when the heat is off, but what about the other side of the coin? What happens when that thermostat is cranked all the way up and stuck on high? Well, that sends your body into a whole different kind of crisis.
Yep, we're talking about hyperthyroidism. This is where your body is just flooded with way too much thyroid hormone. This makes you super sensitive to your fight or flight hormones, like adrenaline. And the result? Everything goes into overdrive. We're talking anxiety, a heart that feels like it's going to beat out of your chest, losing weight without trying, and feeling hot all the time. It's like your body's engine is just constantly redlining.
Now, here's where things get a bit more complex. Unlike the pretty straightforward fix for hypothyroidism, tackling an overactive thyroid means choosing between three very different paths. And there's no single best answer here. The right choice really comes down to the individual patient, what's causing the problem, and their specific situation.
So let's dive in and break down these three ways to cool the system down. Because, like we said, the right choice can be tricky and really depends on the person.
First up, we have medication. You can think of these drugs as a dimmer switch for your thyroid. They work by slowly, gradually turning down the gland's ability to produce new hormones. It's important to know they don't destroy the gland or anything like that. They just pump the brakes on production. This gives your body a chance to use up the hormones it already has, and slowly, things start to get back to normal. Now, these drugs can be really effective, but there is a rare, and I mean rare, but serious risk to be aware of. It's a side effect called agranulocytosis, and it causes a major drop in your white blood cells. The cells that fight off infection. This means something that seems minor, like a sore throat, could suddenly become a big deal, a real medical emergency. That's why it's so critical that patients know to report any sign of infection to their doctor right away. So, when it comes to the two main drugs, carbimazole and PTU, the choice is actually really strategic. For most people, carbimazole is the go-to. Why? Because it has a lower risk of causing serious liver damage. But, and this is a big but, PTU becomes the top choice during the first trimester of pregnancy, since it's safer for the baby. It also gets used in this rare, life-threatening emergency called a thyroid storm, because it just works faster.
Okay, on to option number 2, radioiodine therapy. This is a fascinating, super targeted treatment that permanently turns down the thyroid's activity. See, your thyroid gland loves iodine. It just soaks it up. So when a patient swallows a tiny capsule of radioactive iodine, it's like a heat-seeking missile. It goes straight to the overactive thyroid cells and quietly zaps them, without really affecting the rest of the body.
But of course, because we're talking about radiation, this treatment is not for everybody. As you can see, it's a hard no for children and for women who are pregnant or breastfeeding. And while it's often a one-and-done, definitive fix, there's a really big trade-off to consider. It often works so well that it results in permanent hypothyroidism. And what does that mean? It means the patient will probably need to take thyroxine for the rest of their life.
This table really helps pull it all together. It shows you that picking the best treatment is all about strategy, a conversation between you and your doctor. For instance, if you're hoping for a shot at remission where the thyroid calms down on its own, medication is probably your first step. But if you want a more permanent fix, then you're looking at radioiodine or even surgery. And of course, if there's even a hint of cancer, surgery immediately becomes the only real option.
So after all this, turning the heat up, cooling it down, what's the end game? What's the ultimate goal? Well, it turns out the destination is exactly the same for both conditions.
The goal for every single one of these treatments is to reach a state of perfect balance. It's a state called euthyroidism, and you can think of it as the Goldilocks zone for your metabolism. Not too high, not too low, but just right.
And it's so important to remember that getting to that balance isn't usually a one-time fix. It's an ongoing journey of fine-tuning your body's master thermostat. It takes patience, really sticking to your treatment plan, and keeping an open line of communication with your doctor to make sure your body is running in perfect harmony.
And that really leaves us with one final thought. Your thyroid is literally setting the pace for your entire body, every single day. So maybe it's worth asking, is it time to check your settings? Because understanding this tiny but powerful gland, well, that's the first and most important step toward taking control of your health and making sure your body's master control system is running exactly as it should.